A mastectomy is the removal of the entire breast. If you have been diagnosed with breast cancer, this is one of the operations you may have been recommended to have. In this video, I'm going to be talking about what a mastectomy is and what to expect after surgery. Hi, my name is Dr. Tasha and I'm a breast surgeon. So there are a few reasons why you may have been recommended to have a mastectomy. And I have actually made a video about this, which you can check out in the description. So a mastectomy is where the entire breast is removed, including the skin of the breast and the nipple area as well. If you have a mastectomy, once the breast is removed, your chest will be flat. Now, you won't have a gaping hole in the chest. Instead, there will be skin overlying where the breast used to be, and in place of the breast, there will be a scar that extends across your chest wall. The surgery itself doesn't take long to do. It's usually about an hour to an hour and a half, and it's likely you will have some sort of armpit or auxiliary surgery at the same time. In some hospitals, you can go home on the same day of your surgery. Otherwise, you can expect to stay about 1 night to maybe 2 nights. So what can you expect after surgery? Well, you may have a drain that is placed just underneath the skin, and that drain connects to a small plastic bottle. This may stay in for a few days to drain any fluid that is expected to be produced after this kind of surgery. But also, you may not have a drain. It really does depend on the preference of your surgeon. People ask me, is a mastectomy painful? Actually, it's not that painful. And although a mastectomy sounds like a big operation, and in some sense it isn't that painful. And the reason is that the operation happens on the surface of the body rather than going into your abdomen or your chest, for example. So on the whole, it's very well tolerated. Most patients have enough pain control with paracetamol alone and sometimes supplemented with ibuprofen. Now, one of the things that you will experience after a mastectomy is feeling of numbness across the chest wall where the breast used to be. And this is usually a permanent thing. You won't feel sharpness around this area at all. What you might feel is a sensation of pressure. So, if you're pushing the area, then you might feel that, but you won't feel any sharp sensation. Now, before I talk about the aftercare, if you are getting value from this video, do consider subscribing and hitting the notification bell so you don't miss any of the upcoming videos. And I really appreciate your support. Okay, so let's get back to the video. One of the things that you should do after a mastectomy is to massage the scar. And you should check with your surgeon when you can start doing this. You can use moisturizing cream or a lotion, and you should apply it across the scar and massage the area. This will help loosen the scar across the chest wall, which can actually make it much more comfortable in the long run. If you don't want to be lopsided and want to have shape in the bra after surgery, you can get something to put into the bra to resemble a breast. Immediately after surgery, you will get what's called a softie, which is a breast-shaped mold, which is usually made of very soft and spongy material. And this will be gentle on the scar, and you can put it into your post-surgery bra. Once the scar has healed, then you can have a more permanent prosthesis that you can put into the bra for symmetry. And this is usually made out of more durable material, and usually you will get measured for this. These days, you can get really good prosthesis that you can wear and nobody would know that you've had a mastectomy. I hope this has been helpful. Did you have a mastectomy as part of your treatment? Let me know in the comments, and I will see you in the next video. Take care.